I'm now happy to introduce Pat Murray from Cleveland Westside Village in Ohio and a member of the Ambassadors Group to offer his commentary. Pat?
Hello. My name is, as Emily said, my name is Pat Murray. I'm the president of the board of the Cleveland Westside Village in Ohio. We're a small village. We have about 45 members, and we're an urban neighborhood. That's actually one of our biggest struggles these days is the gentrification that's going on in housing. Um, and But I just wanted to offer a few thoughts about what we just heard. Um, and there are some really positive things and some things that I have some questions about. Um, Person-centered comparative outcomes research, I think, is the definition of that was first. And one definitely positive aspect of this is the inclusion of participants in the design and selection of research questions. Um, and I think also, I think we want to make sure that as as the trial, we go beyond just doing research questions, but um, in the formulation of the actual plan of research, it'd be important to involve the participants and villages in that as well. A couple of questions I had is this, are there enough rigorous randomized trials of intervention services to really utilize this method? I just I I don't really understand how much there is of randomized trials to compare when we're looking at the kinds of questions that I think villages are most interested in. And the other question I had, and I probably should have asked this a long time ago, but I didn't. Will comparison of practices between villages be appropriate for the research designs, or is it only research randomized trials that have already been studied that will be part of the research design? So those are a couple of thoughts about the overall issue. Next slide, please. So then the next section was, what do villages think about healthy aging? And four things were mentioned: physical health, mental health, good physical health, good mental health, cognitive health, and a sense of social well-being and purpose. Um, and I think it's a little bit concerning to me that the backdrop for this slide had four uh, older people, I think, sitting on a curb, probably after having played pickleball or having a run together. And I think this, to me, this points out that there's sort of an overemphasis on physical health in some regard. And I think the sense of social well-being is probably the most important aspect of this. We have a number of members in our village, and we're a small village, who have severe physical problems, and we have some members who have cognitive problems. It's still our thought that they can have a sense of social well-being and purpose despite those things existing. So I'm not sure that a picture of healthy aging that is more sort of athletically based is an ideal way to think about this. Um, and I think social well-being and purpose are the most important aspects of healthy aging. Um, then there's a thought that healthy aging is highly dependent on the health infrastructure. And the quote that's referred to there is, illness lives in the hospital, well-being lives in the community. And I don't disagree with that, but I'm not sure that there's a real strong connection for many people between the health infrastructure and the quality of their life and their social well-being. And at some level, I think the report overemphasizes this connection between health and and villages, healthcare institutions and villages. Um, Next slide. The next section was, how do villages support healthy aging? And there were four things that were noted there: social connections, function through prevention, information hub, and bridge to the healthcare system. in our village's experience and practice, social connection and educational functions are extremely important. Uh, we also provide services to people, but have found, somewhat to our surprise, that the social connections and the educational functions are more important than other things. The idea that prevention and bridge to the health care system are not so much an issue for us. And actually, I think it was a little bit odd to me that the slide of prevention had a person eating an apple or getting ready to eat an apple, which really makes me think about, an apple a day keeps the doctor away. And I'm not sure that's how we would characterize the work that we do, unless preventing social isolation and getting rides to the doctor count for this prevention and bridge to the healthcare system. Um, and then there's a slide that doesn't quite fit anywhere, but it's about advocacy. And I think our village has taken on, I think it's partly because of the housing issues in our neighborhood, um, that we've taken a very active role in promoting affordable and accessible housing in our city, which is rapidly, very rapidly disappearing. I think that's my last slide. And those are the comments that I have. Oh, I'm sorry, another slide. Can't count anymore. Um, what could help or hinder villages participating in research? Research questions that are of interest to villages will be the most critical thing to me. Um, and one of the issues is, how do we, across villages, find information that is needed to grow, allow our villages to grow and prosper? And then I think providing support to conduct the work is very important. And I think there's been some discussion about standardization of data collection using the existing systems. Finally, I think we have to make sure that we don't overpromise villages what can be done. Um, Preventing emergency room use and nursing home placement may be quite hard to demonstrate based on decreasing social isolation, which I think is a major factor in what we accomplish. It might be better to stick with more quality of life measures. And that actually is the last slide I have. Thanks very much for your attention.
Thank you so much, Pat. I really appreciate it. This is Emily Greenfield again. I just want to thank you for your thoughtful and insightful comments, highlighting key considerations for person-centered comparative effectiveness research with villages, as well as for your critical perspectives on the meaning of healthy aging and how villages serve as an asset to their communities and the individuals involved.